It's my episode, we will be outside. I'm just saying. On your porch. Right, Mama? You will be outside?
What's up, everybody?
Mama.
Week. What's up, everybody? My name is Jesse, and welcome to the Jess Takes a Village podcast, where we focus on regular people who have used their education, whether it be formal, vocational, or even life experiences, to propel their lives in a positive direction. Now, after 3 years of waiting, we finally got Emily Mora on the podcast. What took you so long?
I was waiting for you to invite me.
Well, before that, what took you so long?
I was waiting for you to invite me.
I don't really know, your current working schedule, but I know you're always working. So just to, start off, because people will watch this episode and they'll see you wearing the scrubs, what exactly do you do for a living?
So I'm a physician assistant. We're now changing our name to physician associate, but that is my career field.
And because a physician is a doctor, so what's a physician associate for the younger generation who's watching this?
So a physician associate is someone who collaborates with the physician, okay?
Mm-hmm.
So our roles interject.
Yeah.
So we do mostly similar work. So we can prescribe, diagnose, treat, but the whole point of our profession is that we work in collaboration. So we can open our own practice independently. It's always in collaboration with the physician.
Now, I don't know too many physicians associates, and I know the people who are watching, some probably who have never heard of it, right? Because when you go to the typical doctor's office, your doctor, maybe the medical assistant, maybe a nurse or the receptionist.
Right.
But you're there, but you're not really there. You're not really known just to the regular people. So why physician's assistant? Why that career path? Why that choice to start off?
So I agree. A lot of people don't know who we are and our roles. Because to the regular person who walks into a clinic or anywhere else, we're seen as the doctors.
Absolutely.
One, because we do most of the same things, okay? Again, treat, diagnose, prescribe, everything. So that's why a lot of people don't know about us. And also, I feel like now it's a growing field. So now there's a little bit more awareness. And because you're doing this podcast, everyone knows. Hello.
Absolutely. Tune in, yeah. So how did you even find this field? How'd you get into it? Do you know someone? Was it like a little bit of influence? So take me as far back as you can remember. Let's say Emily is 12 years old. Is she aware of what a physician's assistant is?
No. Although the career field has been going on for over 30 years.
Absolutely.
At 12, no. Also, at 12, I didn't know I wanted to enter the medical field. I thought I wanted to do sort of like the business route, accounting, because that's what I saw around me.
Right.
And then when I went to college, I went to Lehman College. Okay, shout out to the Bronx. I don't live in the Bronx, but I'm just saying.
Doesn't matter if you would live in the Bronx.
But anyways, when I went to Lehman College, I got exposed to different career fields. I thought I wanted to do and enter the doctor's field, pre-med path. And when I graduated with my biology degree. And so after exploring, after I graduated, I entered the workforce. I worked for Mount Sinai while I was studying for my MCAT. And then I was like, I can't imagine, going through school for another 8 years. And that's when I came across physician assistant. And so I actually had to go back to my undergrad to do some prerequisite courses to get into PA school. And it's a master's program. So it's 2 years. So you finish your bachelor's, you do 2 years master's, and you're out in the workforce. So that is what attracted me to the field.
It's just very interesting to hear you say this, because as you're telling me this, I'm having flashbacks of us sitting together in social studies class. I'm in 10th grade, you're in 9th grade. And to see the girl that was behind me, we were cheating, obviously.
Yeah, I was
Don't
cheating
hold us
off you.
accountable.
I was cheating off
Right?
you.
But to see the little girl sitting behind me, fast forward to the woman in front of us, all those years have been dedicated to growth, discipline, and focus. So one of my first preliminary questions to you is, where'd this level of focus come from? Because the medical field is one thing, starting it is something else, but actually seeing it through. So I'm pretty sure along your career path, you've seen people start, start, stop. You've seen people maybe start, quit, completely change their career path. So where'd that level of focus come from early on in life?
I don't know. I feel like I've always been sort of driven in things that I focus on and put my mindset to. But I feel like in real life or out in the workforce, once you start working and you finish undergrad, and you enter the workforce, some people can kind of like forget about who they, their dreams or what they want to accomplish in life. So I feel like there's always been a drive. And, I don't know if I'm answering your question, but I've always been, eager to enter the workforce, whether it was as a doctor or a PA or even a nurse, I just really enjoyed my role as a healthcare provider. So I knew that that's what I wanted to do. The only thing I really questioned was how I was going to get there,
Yeah, I think the how aspect of it is very important, because as somebody who struggles with constant student loan debt, y'all not taking my money, but as somebody who's had to pay, because I didn't understand the college route at first. I went to a private school first because I didn't really get help from a college advisor. Then after doing 3.5 years in private school, I switched over to CUNY. Now, as you know, med school and those programs are not cheap. So how are you able to just, because I struggled with paying for classes. I'm open, I'm loud, and I'm proud about it. How'd you get through all those years? Because these things are expensive. Were you getting scholarships, grants, tap, credit, debit? What if you want to?
Of course.
What was some
so
things?
My undergrad, I was fortunate to be part of a CUNY, and my parents weren't making enough. So I got all 4 years were financial assistance.
Oh, that's amazing.
Financial aid.
Yes, sir.
So for my undergrad, I don't think I paid a dime.
Shout out to those checks.
Right, agree. And then for my master's program, there I had to take out loans. Yeah.
Me too.
Because it is.
I mean, my program was 20 something and change. 20,000 for those who don't understand the lingo, but it's like I can only imagine what your program was.
Yeah. So med school, which is something that attracted me to becoming a PA. Med school, you're coming out of there with 200, 300,000, 400. I know a friend that has $500,000 of debt. PA, it's a fraction of the price.
Okay.
So actually, SUNY Downstate, which is where I graduated, is the cheapest PA school in the entire nation.
Downstate. Yeah.
Right, we love you. And so tuition is $55,000 for the entire 2 years. However, obviously you have other expenses. So with all those things, my school debt came up to $120,000. So I graduated with $120,000 of debt. But again, with working, with the privilege, with everything that I'm currently, I feel comfortable.
So after all of those years of hard work, you reach this level of comfort. Now, when you're at this point of comfort, do you now develop a sense of, I'm going to just stay where I'm at for a little bit, or do you seek out more? Because a lot of the times, myself included, and even other guests that I've had, we spend so much time going through the motions and getting to the point of where we want to be. And then when we get there, it's like sometimes you become recluse. Sometimes you relax. Sometimes you take a drink because it's like, I'm finally here.
Yeah.
Then you have the special others who like, now that I'm here, let me go elsewhere. Yeah. Has that been the case for you? Are you content just being a PA?
So right now I'm actually really happy where I am.
Good.
So I graduated 2 years ago. So once you graduate, there's still so much learning to do within the job, within the field. So till this day, I'm always learning. I'm always opening a book. I'm always researching. So at this moment, I like this place of learning and growing, right? But maybe in the future, who knows? I could always continue. I could get another degree. But right now, I think
you sound like someone who loves school.
I actually do love school.
I love school.
Yeah. I think school is very essential.
So compare your first day of PA school to your last day of PA school. Give me like 3 emotions from your first day of PA school, if you could go that far back and remember. 3 emotions. How do you feel?
So I feel like the first day, anxious, eager, and driven. And it's so funny because the last day of PA school is the same thing. Anxious, driven,
eager.
Because those feelings when I first started was, oh my God, I'm entering school, I'm learning all these things. Now when I graduated, now it's like, oh shit, now I gotta take care of real patients, now I gotta do real shit, real work. So same emotions, interestingly.
I only ask because I know for me, when I first started grad school, that first day I was just like, Jesus, I'm finally in. And then the last day, I'm like, wow, that went by quick. I tell people, listen, academia may not be for everyone. Going to school may not be for everyone. But that feeling you get when you put on the gown,
right,
and you're standing in that crowd, and they tell you to put your tassel over, or they tell you to fix your hat and your gown, that's just what it is. You know, it's a very special feeling because you ask yourself, what did it take to get here? And it took being anxious, being eager, being driven. So now you're in your field. What's the job market like? Like, how do you know where to apply to? I'm a young kid watching this. I want to be like Emily. I want to be a physician's assistant. Where do I apply? Where do I look for?
So if you're entering, if you're finishing like your undergrad, you finish your undergrad, you have to make sure that you're taking classes that align with certain schools. Every PA school has different like prereqs.
Right.
So you kind of make sure you're checking off those lists. They definitely require you to shadow. You have to shadow a PA, so at least you know what the
right,
what you're getting into basically. Before they didn't require, some schools require GRE. Now they're actually creating a new test like the MCAT.
Yeah.
It's called like a PA CAT for physician assistant, because now that people are becoming a little bit more aware of what PAs are and what we do and our role, it's gotten very competitive.
I'm not to cut you, but I know what the MCAT is. Tell them what the MCAT is.
It's a pre-examination,
right,
or pre-exam or whatever.
Right.
What is it? A pre what? What would you say it? Is that your door?
I guess it's a package. I'll just go get the package.
Okay, I'm gonna get some.
How ironic.
Here, Mama. Yeah, Mama.
Come in. Man? Don't bother bring your machine. Sit down and rest with your queen.
Appreciate it. How you doing?
Have you had to record something?
Yeah.
Have you had to sing a song?
Nah, I'm in the interview right now.
I think I sing it.
Yeah, nah. Thank you.
All right?
Yeah.
No, Mama. We asked what the MCAT was. It's what, like a pre... Oh, are we still on?
Yeah, we're still on. That's fine.
So the MCAT is an exam that you take before entering med school.
Right.
It's very difficult. It's like 5-6 hours long, and it goes through physics, anatomy, like all these topics that you know come across in your undergrad, and then they score you. So the higher the score, the more likelihood you get into a medical school. So it's a medical school examination. So now what they're creating is a PA school examination.
Damn. So I assume now, when you shadow and you're getting ready to leave your program, who's helping you find a job?
So the job market is pretty good for us.
Okay.
There are jobs everywhere,
Right,
every
yeah.
hospital, every specialty.
Yeah.
So the good thing about a PA is that you can go within one field to another.
Yeah.
So you can today decide you want to do OBGYN, and then you're like, no, I want to do orthopedic, or you want to do neurosurgery, or you want to do any specialty you want. There's a job for
Do
it.
you have a specialty?
I do. I actually work in neurosurgery.
Now I know what that is,
Okay.
but
Neurosurgery is
yeah.
you deal with brain and spine. So patients that have brain tumors,
Yeah.
brain masses, brain lesions, they come to us.
Yeah.
And whether you have any back issues, lower back pain, sciatica pain, all those things, they're referred to us.
So the only reason why I always tell you to delve into detail is because, as I told you, you better take the phone. I'll take it.
I think it turned off, that's why.
Thanks. Oh, it locked.
Yeah.
Oh, it's open. There you go. The only reason why her little one is to the right watching some video. But the only reason why, what was I saying? Oh yes. The only reason why I keep asking you to get into detail is because I often stress, as you know, I'm a teacher, I often stress the importance, especially to the girl students in my class, about striving for higher in life, right? It's okay if you want to work a job, but why not try to perfect their craft? Why not try to be at the top of the chain?
Right.
So the only reason why I ask you to get into detail is when they watch these things, which they avidly do, they come the next day in class and they tell me about what they've seen.
Okay.
And they ask me, oh, you have a lot of friends who are girls. Do they make a lot of money? Do they have their own house? Do they have a family? And I tell them yes.
Right.
And they go, how? And I go, well, they go to school. And when you watch all the episodes where more and more people come on, these should be your role models. People who come from other countries, people who have family who are immigrants, people who came to the country with nothing. And we're like the first generation of Americans who really have to put our foot in the sand and really work. So you serve as a means of inspiration, not just obviously to me, but to the little girls in my class and whoever's watching this. Because you're the first of your kind on this show. You know, you have a formal education. Yes, you should clap for yourself. You have a formal education, but you kind of work with your hands every day, right?
Right.
So I wanted us to like do a scenario. I walk into urgent care.
Right.
I just need like a physical. I come in, they go, okay, you're gonna go see Dr. Mora?
PA Mora.
PA Mora. Okay, I come in, I sit down on that chair with a white thing on it, which makes the unnecessary noise. How do you enter? What's like your go-to speech? So let's say you sit down, it's the first time you meet me. You walk in, you look at the charts, you go on the computer, you sit on the rolling chair. How do you introduce yourself?
Well, one thing, I always introduce myself as a PA because I don't want to take credit as a doctor.
Right.
I'm actually very proud of being a PA. So I work in a hospital setting.
Yeah.
So if I'm walking around seeing my patients, a lot of the nurses will always say, doctor, do this, doctor, can you put this order, doctor, this. And I always kind of let them know, hey, I'm a PA, just so that they understand, one, I'm a PA and I'm doing this, okay? And one, to give credit to my field. So if you were to come in, I'm going to walk in and say, hi, this is PA Mora. What brings you in? What brings you in, Jesse?
I'm going to tell you, my knee hurts.
Your knee hurts. Okay. And honestly, to go into it, it's a lot of back and forth.
Yeah.
How long did your knee hurt?
Right.
When did it happen? Any trauma? Any falls? Were you playing basketball?
Right.
You know, it's more of the history behind it. And in an urgent care setting, you would, if it's something serious, obviously you do an x-ray,
right.
You wrap it, or you refer them to orthopedic.
Okay, so you write prescriptions too?
We do.
So we write.
Yep.
Oh,
so
no,
Jesse,
but not anymore. You guys go on the computer.
We do. So
I remember,
electronic. Yeah.
I remember the generation where my doctor or my primary care physician would sign. I'm like, is this really your handwriting? And then they would send it. I would take it to Rite Aid. You know, you give it to them, they look, they fill it, and it goes on.
Yeah, so in our field, neurosurgery, it's a little bit different because we're in a hospital setting.
Oof.
So sort of like a day-to-day of a neurosurgery PA, you know, you walk in, you do rounds on your patients.
Okay.
After rounds, you go ahead and go into any surgical cases that we have.
Okay.
So surgery for neurosurgery can last anywhere between 1 hour to 5 hours.
Yes.
Okay. And the hospital I work in, there's no residents, so we work hand in hand with the doctor. So if you're the surgeon, this is our patient. You're to the right, I'm to the left. So we're working right
wow.
amongst each other. Yeah.
And you've actually, I'm gonna ask a kid question. Have you seen a brain before?
Absolutely, all the time.
Wow.
So a little graphic, but the way
Yeah.
it works is that if someone has a hemorrhage, a subdural hematoma, that we need to do a craniotomy. So a craniotomy is where you remove the skull.
Yeah.
Okay. Yep. You, whether it's a mass, you go ahead and remove the mass. Whether it's subdural hematoma, you remove the blood clot, and then you put the skull back on and close it up. So yes.
Sheesh. And then stitches.
And then whether stitches,
Sutures. How you call it?
Yeah, sutures.
Sorry. Stitches is for children.
Yeah.
But this is like crazy because when I watch Grey's Anatomy, and I know this is such a bad reference, and I hope I'm not disrespecting your field.
No, I love Grey's Anatomy.
But when I watch Grey's Anatomy, I always wonder, is this show as accurate as they portray it to be? Where like all like the medical jargon and the surgeries, is that at least accurate? Or do you watch these shows and you're like, I could pick this out, I could pick this out?
Actually, surprisingly, with Grey's Anatomy, like maybe some of the hospital jargon is
okay, yeah,
what obviously that you see, but obviously not the drama, you know.
Sheesh, I don't know. I often wonder because, off to another topic really quick, but I have coworkers whose husband is a firefighter, right? Mm-hmm. And when he watches Chicago Fire,
right,
or any one of these shows, he's like, we would never do that. Like, it's not really accurate. Don't sue me, but that's what they're saying. So,
well, yes, I agree. Obviously, things on TV is dramatized, you know.
Yeah, I know the word.
Yes, but the one show I haven't seen Grey's Anatomy in a while, but I don't know if you watched Doctor, what's that show?
House,
yes. House uses a lot of hospital jargon, and surprisingly, most of the things that he says, I'm like, oh wow, yes, you know.
Yeah, so, I know, but if he was in the real world, he would have lost his license like 7 times over.
But I love that show.
Can't be on Viking and doing surgery. But I actually want to go back to you being 18, fresh out of high school. What's your first job like?
So actually, in high school, I used to work for Auntie Annie's. So I used to work fast food.
I know the pretzel place.
Yeah, 34th? I love that. Yeah, 34th.
You were working with
Yes, I was.
You was working with
Yes, I was. And so that's what I did during high school. During college, I did tutoring. So it just worked out because, one, I was already in campus, and it helped me learn all the material I was learning. Chemistry, biology, physics. Sheesh. So I was a tutor for those courses. And so after I graduated, I did City MD, medical scribe. Then I went to Mount Sinai as a clinical research coordinator. And then that's when I went back to PA school. So I worked in between graduating to starting my master's program for about 4 years. Yeah.
So I know there are some people who have the luxury of just going to school by itself, and there's some people who just have to work because they can't balance the time. Explain to people, what is it like actually to have to go to school and work at the same time? Keep a little money in your pocket and still study for these tests. What's that like?
It's actually really challenging, but the point is to make your work environment an environment that kind of uplifts you.
Right.
Okay. So during undergrad, I was like, I want to be a tutor, although obviously I could have made more money somewhere else, but it helped me so that when I take these exams, like the MCAT or any exam that I needed, I had the knowledge fresh, you know, and it put me in an environment where it was sort of adding to
feeding you.
Yep, feeding me. Yep, exactly. So feeding my ambition, you know, because as a tutor, you see everyone around you and everyone's in an educational aspect, you know, in an educational environment to kind of
And I feel like once you're in that environment, there's no option but to thrive,
Right.
right? Because it's like, I always tell people, when you get to school, one of the best things you could do is find yourself a group of people who's on the
Right.
same career path as you. Now, I had the luxury of being surrounded by so many other young people who wanted to be teachers. So it made a lot of the student teaching, the lessons, the mentoring, everything went across very smoothly. Now, with this podcast being the Just Takes a Village podcast, we also like to focus on the people who've helped you get to where you're supposed to be in life. Who are those people that kept you going times when you said, you know what, maybe this isn't for me? Who are those people that gave you the proverbial kick in the ass, excuse my language, the little one, or the push in the back? Who are those people?
So I think that's a good question because
Yeah.
during my undergrad,
Yeah.
I actually did summer programs, and I feel like those summer programs were so instrumental to my growth. So instead of me, I don't know, doing something in the summer that wasn't sort of giving me the drive, the ambition, I did pre-med summer programs, and there were 3 consecutive summers, and they really helped guide me. Okay, so if I had any questions, it was a cohort of like maybe at least 50 students.
Yeah.
And so they gave us the education, the class, the mentorship. So I think mentorship is very, very important. And especially when you don't have anyone around you or anyone that looks like you in these roles that you want to soon be in, mentorship is a great way to kind of see yourself there.
Absolutely.
So those summer programs were very, very instrumental.
So you got the cohort in which they were able to guide you in your practice and give you that extra bit of advice. Who else?
1 second. Mama. Mama.
It's fine. She can stay on the show always.
Okay. Yes, Mama, you hear the doggy? I mean, family is very important.
Right.
But sometimes family can also not see your vision.
Absolutely.
You know? So even if family doesn't see your vision, you surround yourself around people who
see your
do
vision.
see your
That
vision.
is so.
You know?
That is so
I'm not,
important.
knocking family. Family is very important. But sometimes if your family members around you have not sort of I guess see your vision, see your goals, they sometimes can bring you down. I remember my mother used to say, when I used to tell her I wanted to become a doctor, she's like, oh, how about you just become a nurse, or how about you do something like different, because she's like, no one in my family is a doctor, you know. So those were things that she didn't envision, you know.
Yeah. So outside of, well, that is true. So just surrounding yourself now.
Yeah. Sorry, I'm just
No,
gonna place her back.
it's fine. Take your time.
Mama, stay, okay? No laughing, you stay.
So outside of,
Mama, stay. Wait for mommy, okay?
we full of personality.
Yes, Jessie sees it.
Let me see. Let me see. Oh, what are you watching?
She's watching her vegetables, her veggies. Okay, Mama, you can stay right here. Stay right there.
Oh, nice. She's having the time of her life. But outside of so far we got the cohort, and we have family or the friends that keep you surrounded. Anything else? Anyone else in particular? Like maybe you had like a teacher who never gave up on you. Maybe you had a couple of professors. I mean, granted, they all mentioned in the cohort, but sometimes it's nice to like shout out the people who personally like helped us get there. Even like for me, it was my professor at Brooklyn College who let me into the program, then took me to go do research, and then like really schooled me on how to teach mathematics education, right? And that guy was just like everything for me personally, because I always feel as if teachers need teachers to teach them, and PAs need PAs to PA them. If you understand what I'm saying. Did you have like a specific mentor that really just said, you know what, I'm taking you under the wing?
You know, I can't really point out one person that was, you know, that for me.
So many.
But everyone had a instrumental role.
Yeah.
In the whole mission, in the whole goal.
Hence the village.
Yeah.
Hence the village. So I tell people, these members that we have, whether they're here now or they're not here anymore, they all play like little pivotal roles.
Right.
And I obviously this wasn't like on my line of question, but I wonder what would have happened to you if you listened to your mom.
You know, I probably would have been a nurse, but also like shout out to the nurses, you know.
No, absolutely, you know? Right. But do you think you would have hit that pinnacle of being where you are in the medical field if you would have listened?
But also, I don't really take my mom serious, so like, she could say, you know, she could say these things, but you know, again, she grew up in the Dominican Republic. You know, what she knew was what was around her.
Absolutely.
So although she was giving me that advice, she didn't really understand the things I was doing in school. I couldn't explain to her what I was learning. I couldn't explain to her why I wanted to do this because she just doesn't grasp it. Till this day, she forgets what I do for a career.
I'm weak.
So, till this day, she doesn't even understand what a PA is. She always asks me, when are you going to be a doctor? When are you gonna...
It's like the same. I mean, I'm not gonna like kick it to the side, but it's basically the same thing.
Yes.
I'm sorry, but that's just how it comes across to me. Like, you look like a doctor, act like a doctor, talk like a doctor, walk like a doctor.
But we're PAs.
Yeah, but you're PAs. Let me see what you have. Veggies got you going crazy.
She loves her veggies.
You like veggies and fruits? Well, I mean, while she's here, you might as well just introduce it to the world.
What's your name? What's your name? What's your name? Hi, what's your name? Her name is Celine. She is about to be 2 in August. She loves to dance. Mama, show your moves. Oh, yeah. And she is my sunshine.
Very nice. And would you say she's one of the reasons why you get up every day and you work that 12-hour shift?
Absolutely. I wake up 30 minutes before just to stare at her.
Yeah.
But she's my drive, you know? And just thinking about how it was the other day that, you know, I gave birth to her and now she's about to be 2. But she's my everything.
How's motherhood added value to your life? How has it?
I think motherhood has definitely opened my eyes to how much joy one person can give you, you know?
Absolutely.
Motherhood is challenging. Every day something new. But I wouldn't want it any other way. Yeah. Okay, Mama,
now,
we're not.
Because of...
Sorry, Justin.
Don't sweat it. She's a little child. That's normal. That's actually more normal than you think. Because you know what? Somebody who's going to be watching the show who has children, who's going through the same thing, they're going to be like, she's actually still able to maintain this career and still take care of her little ones.
So actually, I was pregnant during PA school. Yeah, so my last year in PA school, I was pregnant. And I was walking around my rotations. So a little bit actually, I forgot to say what PA school's trajectory is.
Yeah.
So once you enter PA school, the first year is books. So it's the didactic year, you know, you're doing all these classes. Then the second year is clinicals. Mm-hmm. So you're rotating within 10 different specialties and you're rotating at different hospitals. So I was pregnant my last year and my belly really wasn't showing until my last 3 rotations. And it happened to be my last rotation. One of my last rotations was the emergency room. So I had a huge belly walking around the emergency room, you know, during my rotation. So
Sheesh.
if I could do it, anyone can. Yeah.
Sheesh.
And I walked down the aisle with a huge belly. Yeah.
And you crossed it.
And I crossed it with her in time. Yep.
And that's all the motivation one needs. My last couple of questions. Now that you got to this point in your career, what luxuries now are afforded to you because you got to this point in life? So, for example, there are some people who they work a 9 to 5 and they have to take home work. And because they have to take home work, they can't really spend as much time with their families, right?
Mm-hmm.
So, what would you say that PA has done for you just to make you say, like, I'm here?
Right. So that's a good question, because what actually drove me to become a PA is work-life balance. You know, I think that's very important to me. One, because I want to create a family. I want to have 10 kids, you know? So I want to be able
10
to...
is an example, right? Live your life.
I'm just kidding, but
Yeah.
you know, I want to build a family, you know, and that's very important to me. So when I was reflecting whether I wanted to go to med school or PA school, that was one of the things that drove me to PA. So I work 3 shifts, 12-hour shifts, and the next 4 days I get to spend with my little one, you know?
Yeah.
So I start at 7, end at 7, and I don't have to worry about work anymore, you know? Throughout the day, yes, if they text me or things like that, but I'm free. 3 days and work 3 days and 4 days off. So I have a lot of time in my hands, you know? And that's what drove me to become a PA, you know? If I was to choose a medical school route, I have friends that are in medical school and doing their residency. You know, I have so much respect for doctors because obviously we work in collaboration. However, it's a lot of stress on an individual.
Absolutely. I can only imagine.
You have to finish medical school, and then you got to take step 1 and step 2 and step 3, and then your residency board. We take 1 certification exam and we're done, you know?
Wow.
And what else can I say? I you know, it's less stress. It's less stress on an individual, and you go home and you take care of your child.
And you also financially actually get to live a little bit, you know?
Right.
And I feel like that's another thing, because you do have people who they say, you know, there's so many people who go to college and they're not really able to make money or find a job. And usually my response to those people is, well, when you're in college, you have to find a specialty. You kind of have to do your research. You kind of have to really dig deep to see, okay, if I'm investing, it's not really so much the money, it's the time. If I'm investing all this time into my education, what exactly am I going to get out of it?
Right.
And I think one of the best parts about PA school or med school is you learn a life skill. You know, like I'm pretty sure if you ran or like you're with family and you have a niece who falls down and she gets cut, you know what to do.
Right. So if you want to talk salary wise, once you finish PA school, depending the specialty, okay? So every specialty is a little bit different, but you can expect to earn $120 a year starting off.
Now, I don't know if you remember, there was one time I want to say over the summer, right?
Jesse.
We were all in Williamsburg. And so basically the way the story goes, guys, is I was at home and we all have one big family group chat because we're like technically cousins. And while looking in the group chat, I'm like, wow, nobody calls their favorite cousin anymore. So I got invited out. So we all met up with each other on the rooftop. And, you know, because they care about me so much, they asked me, how's teaching going? What's the salary like? So I remember it was you who asked me, yo, like, how's the teaching like? What you guys make? And I remember I sat there and I was like, you know, I make 72. And I remember you looked at me and you was like, wow, you're doing really, really well for yourself. And I'm like, you think so? And you was like, yeah, you know, as a PA, I make 72 too. And I remember I looked at you. I'm like, when would a PA ever make $72,000 a year? And I remember you looked at me. You was like, I thought you meant hourly. And I'm just like, whoa. And I'm just like, look at what
I
you've
did
been
think
able.
I did. Sorry, I did think it was hourly we're talking.
That's fine.
All
teachers are poor.
Yeah.
But
no, but you guys are rich in culture and rich in life.
being rich in life will never pay bills. I mean, rich in culture. But all seriousness though, but look what you've been able to do.
Right.
You know, look how many people have the same upbringing as you that weren't really able to get to that point. And your hard work, your dedication. Now that you have instilled these principles in yourself, imagine having to raise a smaller person and have to teach that small person those same principles.
Right.
So it's like if your ceiling was supposed to be here and you crack through, imagine her potential.
Yeah, agree.
And this is why we do the podcast.
Agree.
We do the podcast to reach out to many different people. And hopefully years from now, she'll even look back and she'll say, well, I see mommy. I was with mommy, or you let her watch the episode. And now she's probably working for NASA. Or she's some big satellite builder in outer space. Or whatever she wants to be in life, you know. Wherever her heart takes her.
Absolutely.
But as long as, you know, we all are under the same agreement. There it goes.
Uh-oh. Sorry, Justin.
Don't sweat it. She's a kid. She's a kid.
Uh-oh, mama.
It happens. I'll bill you
say
later.
Sorry? Yes, we do owe you that, actually.
Don't sweat it. Oh, wow. You know what's crazy? About that car.
Do you want to clean this now, or you
clean it later?
Okay.
My great grandfather. This was like a family heirloom, and we used to like pass it down. So I guess 97 years have just been.
Wait, Jesse.
No, I'm
sorry.
joking.
I'm gonna go to Bogota and get you another one.
No. I think my sister bought that back from Colombia, but it's over. Thank you, Celine.
Oh fuck. Say sorry. Say sorry, Jesse.
It happens. Don't even pay attention to it. It happens. Well, what a way to end the podcast. Thank you for coming on the show.
Of course, Jesse.
Thank you for the inspiration, the motivations. Thank you for coming on the show. This has been my youngest guest up to part. And it's just like that. Thank you guys for tuning in to the Jess
Say good job, Jesse.
Podcast.
Oh my God, Jesse, I'm so sorry.
Don't watch it. It's fun. I hope she knows how to mop.